by taking a moment to reflect on the announcement by the Chancellor today on a number of initiatives to support businesses across the United Kingdom. The extension of the 5% VAT for tourism and hospitality will be extremely helpful for those sectors. The furlough scheme ending next month has benefited 250,000 workers here in Northern Ireland, and whilst I of course welcome the intention to introduce a new support scheme, Ministers are continuing to bottom out the details of exactly how businesses and employees in Northern Ireland will be impacted. In relation to COVID, the average number of daily positive cases this week was 90. Today that number is 150. That's 150 people each day who are being told that they have COVID-19. And the advice from our medical and scientific experts is that if we do nothing, this will rapidly multiply. The R today is estimated to be at 1.5. So I'm asking every person to join with us in pushing down this virus. Our experience and the experience of nations right across the world is that swift and targeted action can suppress the spread of the virus. That's why we put in place robust measures in all types of places and activities when people come together. And these are particularly strict in places where alcohol can be consumed. In our bars and restaurants, customers must be seated, table numbers are limited, and live music and dancing is not now permitted. We have had further discussions on this topic today, and we will finalise more details over the next couple of days. The ministerial-led enforcement group is also continuing to meet regularly. Now, we know that the virus struggles to survive in well-regulated environments where the public health guidelines are carefully followed, but be assured that we will continue to review and monitor the impact of these measures. Because this is all about balance. To do nothing at all allows the virus to run free, and this will decimate lives and livelihoods. And we know that the virus exploits the relaxed environments of our homes and indeed other informal gatherings. That's why every home in Northern Ireland has been asked to limit visitors indoors and indeed outdoors as well. We've seen some encouraging evidence that these measures are working. In a number of areas where the restrictions were first imposed, like Ballymena and BT29, there has been a reduction in the levels of infection, although of course that does not mean that there is any room for complacency. And I do want to thank all those who have faithfully kept to the guidelines. We've made another number of decisions today at the Executive, and the Finance Minister will detail shortly the latest allocations to departments to help spur economic recovery, including for business, skills, research, local government and of course arts and culture. And while we battle COVID, we are also extremely mindful of the importance of ensuring we offer the very best non-COVID health care too. So we had a paper from the Health Minister today, which was approved, around enhancing cancer services, oncology and haematology. And I'm sure Robin will have much more to say on that issue next week. But we do have an ageing population, and of course the risk of cancer increases with age. We need to have increased capacity to address underperformance in meeting our waiting time targets and to deal with the increasing demand for these services. The New Decade New Approach document gave a high priority to meeting the needs of cancer patients by committing to the development of a new cancer strategy and an implementation plan by December 2020. And the development of the strategy is progressing under the Chief Nursing Officer with healthcare professionals, cancer charities and service users, so to place Northern Ireland at the forefront of providing world-class cancer prevention and treatment. That's very important to all of us in the Executive. Rebuilding cancer services, and there are 17 actions to maximise available capacity in that paper, and also to have an oncology stabilisation plan. We've put £8.73 million against that, and we also have a stabilisation plan for haematology services. So all of these things are hugely important to us, and I want to say to the public today that whilst we're focusing, of course, on COVID, we're also focusing on non-COVID healthcare. Because ensuring we deal effectively, particularly with urgent and red flag referrals is absolutely essential. And we need to, as I said, maximise capacity with additional consultants and workforce, and through innovative ways of delivering all of those services.